Welcome to another of our Vitality Chats, and today we are honored and excited to talk to Dr. Lillian Aliberti. She has been with us for years and years and years, studying with us, and she is one of the most amazing people I have ever met. She has just built herself a new clinic, which hopefully we'll get to see later on the talk, but I don't even know what to say about Lillian. She studies so hard. She has such a big heart, such an open heart, and anytime she walks in the room, we just kind of see this big smile come across everybody's face. I'm sure her patients feel the same way. And you can see behind her all her certificates. So she never stops studying. She never stops learning. And we are honored to have her here all the way from Brazil.
Yeah, so welcome, Dr. Lillian. We're just so happy to have you with us. We're so proud of knowing you, and would just like to share your story to inspire some other people. So if you wouldn't mind just sharing with us a little bit about how you got into chiropractic, your chiropractic story.
And a little bit about your background, who you
Yes,
are.
a little bit.
Thank you so much for inviting me. It's a really honor to be here now. I'm a little nervous because my English not too good, so sorry about that. So just introduce myself.
Yeah, who you are.
Yeah.
What,
So I'm from Brazil. I graduated in 2011 here in Brazil, in São Paulo. When I started college, have just two college in chiropractic in Brazil. Now we have five, so we
wow.
start.
Yeah.
Yeah, yeah, it's getting better. Yeah, and when I was teenager, I always think about be a teacher. So because my grandmother was a teacher, and she was a really big inspiration in my life, and probably the most important people in my life. My mom and my dad don't like to ask me, listening, but I love that. But my grandmother was amazing. And when I have 14 years, I was playing soccer. I really like soccer, so I'm playing with my cousin and in a gathering from my family. And then one of my cousin, more older than me, and put me to play me and put me in here in his shoulder.
Uh-huh.
And then another cousin, same size, really big than me, put then in his shoulder. So I was
Yeah.
really tight, yeah. So everybody fall, and then I felt in my butt. So in this moment, I lose my legs feelings. I can feel. I can move in my legs, and we'll go to the hospital. And then they gave me a lot of medications, and then later my I can feel my legs again, but I feel a lot of pain, a lot of pain. And I really felt like a old woman in a young body. Yeah, and I stopped my activities. I stopped the gym. I stopped my soccer because I can't do anything. I can't. So then I start a treatment with a really good, amazing physical therapist, and she always learned me about the spine. She always learned, oh, this is your spine. You have two problems, or three problems. I have a scoliosis, and I broke my coccyx and my L5.
Oh,
Wow. Okay.
And never one doctor talked to me about this. They never say, you broke your coccyx, you broke your spine. So just she. And she always learned me, and I think, oh, I really like this. Spine is amazing. So I've, uh, um after that, I started to think about this. Oh, maybe I changed my mind. I would like to study to be a Portuguese teacher. And then I'm thinking, maybe I will do a physical therapist. And then I will do a specializing in scoliosis or spine, just to treat the spine like her.
Right.
Mhm.
Really good job. Yeah. But she always treat me and I feel better, but just for 1 or 2 days.
Uh-huh.
And then my pain's back. And I took a lot of medications. My stomach works so bad. I feel a lot of pain. I can't sleep because I have a lot of
Acid indigestion.
Yep.
Yeah.
yes. And one day I was using my computer and my mom said, "Oh, Lily, put in your TV and the channel of one guy speaking up about spine treatment. It's a new profession in Brazil." And I said, "My mom, oh, come on, mom. This TV channel is horrible." And I always was a nerd. And I said, "Oh, mom, come on. You don't watch this. This is a bullshit." And my mom said, "No, please shut up. Putting your TV on now. It's about spine. You like this." And I said, "Oh, what is this? Chiropractic?" This is what is was in 2006. And I put a Google and a chiropractor. What is this? Oh, it's a spine treatment. That's what I want. And then I started college, and in my first year, do you remember Pablo?
Yeah,
Was
sure.
a student for you? Yeah. Pablo started to treat me,
Oh.
and in my first adjustment, my mom was in the room with me, and they have a lot of cracks. Yes. And my mom's like, oh my God, what is that? And then, yeah. And then, and then in the same moment, in the same minute, I I feel my back. Oh, I don't know what happened with my pen. It's just like it, I don't feel anymore.
That's
And I
a-
start to cry.
Good.
I start to cry a lot and shaking. Oh my God, I can't believe that. I can't believe that. And my mom said, "Whoa, what are you doing?
That's wonderful.
You broke her. What happened?" And I said, Mom, stop."
Yeah.
I'm crying because I'm really, really happy. And then in this moment, I, I, sh- I really know that's what I want. I need to do the same thing with another persons
Sure.
because I really feel like chiropractic gave to me my life back.
Yeah, sure.
Mhm.
It did.
Yeah, it was amazing. But I have a lot of pain. I have a problem, so I did a treatment.
Of course.
Sometimes when we do a practice in the classes, sometimes I feel pain
Yeah.
because in my college they learn a lot of body drops.
Right.
Yes.
Right. So
So really, yeah.
high part.
So always when I have to use a force, I always feel my back.
Yeah.
Mm.
And then one day I started to talk to Pablo and I said, "Pablo, I think it's chiropractic not for me because look at my size. I don't have I don't strong.
Right.
And how could I do that?" And Pablo said, "Hey, no.
Mm.
Chiropractic is not about force.
That's right.
Uh,
I know you. You are amazing student. I know you be the best chiropractor in Brazil. I know because you feel, you love chiropractic. So I believe in you." I start to cry again.
Again.
And
Yeah.
then so I said, "Oh, do you really trust me like this?" And Pablo said, "Yes." So when I start to teach in my first class, Pablo started in the first class was my students. And then I talked to this story to all my students. And then he cried and he said,
Of course.
"So, do you remember that?" And, yes.
Yes.
Pablo sent me an email to a lot of topics.
Yep.
Why you don't want to do? You have to start and you be the best. So
Well,
yeah, Pablo changed my life. Yeah.
we agree with Pablo. You are the best. You're not what you are so dedicated to what you do, not only to your students, your patients, but also to the students that you teach. So thank you for sharing what inspired you. And so many times it's our own inner journey, whether it be pain or suffering, that leads us to where we need to be so that we can then relieve someone else's pain and suffering, because knowing it from
Yeah.
the inside makes it so much more powerful. And
Yeah.
we find that often with mothers with their new babies, it's like if they know what how much they suffer, then they can share that. So yeah, thank you so much for sharing
Yeah.
the story. It's
My pleasure.
it's a wonderful story. So we know, I mean, so that's the beginning, but all the things that you have done since then. Do you want to share some of that, some of the studying that you've done, some of the work you're doing in Brazil? We'd love to hear that.
Mhm. So I graduated in 2011, and then I started my clinic, and I back to my city. So I'm living in a small city. Do you know the city?
Yep.
So and when I back to my city, I always think about, oh, my city is too small.
Mhm.
Don't have a chiropractor. I'm the first one,
Yep.
and I don't know if I will be the patients, because they love doctors and they love medications.
Right.
So then my mom said, "Oh, just try 1 year. If don't like, you can move it to another way." So I always think about my grandma.
Mhm.
My grandma was here, so I always think, oh, I'll be here from my grandma,
Sure.
because he started to have Alzheimer.
Yes.
Alzheimer's, yep.
So yeah, she never remember me like a granddaughter,
Mm,
but she always look at me with love.
mm.
She always looked at me and said, "Oh, I know you." And I said, "Oh, grandma, do you know who I am? I don't know your name, but I know we are really good friends."
Oh,
So
it's so sweet.
yeah, I saw my grandma every day. I never work 1 day afternoon
Yep.
to take my grandma and go to her sister house
Yep.
to take a coffee and eat some cakes. And every week, 1 day a week, I do this. And sometimes I always, sometimes not always, I help to take care of her.
Yep.
So I always afraid to travel for so long,
Right.
because if sometimes happen for her and I don't have it, I'm don't, I
Yep.
won't hear to her. So in 2017, she passed away. So I was completely lost. And I always think, oh my gosh, what are you doing now every day? So since I was start the college, it was my dream to see to go to the Palmer College,
Uh-huh.
because this is the beginning, yeah.
Yes.
And when my grandma's passed away, I think, oh, I need to put something in my mind now. And then I decide I will travel. I will go to Iowa to. Uh, I did the homecoming from Palmer in August,
Uh-huh.
and in the beginning, I love using the Gonstein technique,
Yep.
because Gonstein changed about the force.
Yep.
And when I did the first pull, I said, "Oh, I can do that in big person." Yeah. And so I think I will do a Gonstead seminar in Monterey to do
Right,
the
the constant, home constant,
Yes.
yep.
the home too, yeah. And we will stay for 3 weeks, and I think about this. 1 week in Palmer, another week in Monterey, and I have 1 week in between. And I think, oh, I will find something in pediatric, and I find ICPA, and that's the ICPA. Oh, I'm from Brazil. That's okay if I'm doing the seminars, blah blah blah. I said, oh, okay. And came to see us. So uh, I did in 3 weeks, 3 seminars, and I start the ICPA series. And I think was impossible because we have they do 2 years to do a lot all
Right.
series, and I think how could I do that living in Brazil? I will travel a lot. Oh, and I think, oh, okay, I will do my best. And then my second seminar was yours in Wisconsin, yeah.
Yeah.
And when the finish the seminar, I just think, oh my gosh! And I knew you because I read books.
Mhm.
Having you in
In the books, yep.
yeah,
An author,
and I
book
always think,
author, yep.
oh,
Yep.
I remember when you took a picture of you.
Yes.
I'm shaking like this. And even the picture is horrible. But I think, oh my gosh, I can't say again. Can I take a picture of you? That's good. That's good. And then I think, oh my gosh, I really need more. I really need to do all series. I don't know how because I don't have a parents with a lot of money. So I have to work a lot to pay this. So I start to work until 10 p.m. all every day. Work a lot to pay a lot of travels by dollar.
Yeah.
And
Big difference in Brazil.
yeah, yeah. And then when I met you, I think, oh my gosh, I really need more. I don't know nothing about cranium. I think I know a little bit, but no. And then I look in your website, and in 2018,
Mhm.
I will go. I went to London to see you, and then and finish the seminar, and I think, I really need more. And then I did the all series ICPA series, and in the final in 2019 you started your program.
Yes.
Right.
In
Yeah,
Boston.
I
Yes.
was in the first, yeah,
Yeah,
in
the first
Boston.
one, yeah.
Yes.
I know
Yeah,
where you were sitting.
and in 3 times, yeah.
Yeah.
Yeah. I
Yeah.
remember.
Yeah. Even with Ken, yeah, in the
Yes.
first
Cameron,
group,
Yeah, what's
yeah,
that?
yes. And
yeah,
Robert.
yeah,
Yeah.
and Robert, yeah,
Right,
yeah.
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 And then in my last class in the ICPA was the same time your last last
Mm.
last class for 3 series, yeah.
Yeah.
And so I did my last class in Grand Rapids and went to Boston to your seminar. So I finished both in the same time, in the
Wow.
same
Unbelievable.
time. Yeah,
That is not
yeah.
easy. Yes. For those of you
Mm.
who listen and do not know what that is, it's like
That's quite a commitment coming from Brazil.
it's a
Long
huge
time
it's
doing
a
that.
huge commitment. It's hard to do if you live in this country, but to come from Brazil and
Yeah.
travel far, it's
I remember another student asked to me, "Oh, are you from Brazil? So, where do you live in Brazil?" Oh my gosh, no way. Yes, I'm here from Brazil every time.
yes.
Yeah.
And yeah, you would sit there, you'd be
So,
as all
so
over the
I did first the Webster certification
Yeah.
with Genion. Yeah,
Sure.
Genion was my first inspiration in a chiropractic.
of
Yeah.
course.
Even if because she's a woman,
Of course.
so we know is more common
Yes.
men's, no? Like reference. So Ginny was amazing.
Yes.
I cry a lot too.
Yeah.
Again. And
Yeah.
then when I finished the CACCP, I did the prenatal certification too, and your series and all your seminars.
Yeah. Yes,
I'm addicted.
and you have done all of our seminars and online and in person, some of them
Yeah.
once. Yes. So
Yes.
yes,
And so wait, now that you've taken all our seminars and you've done all this, what are you doing in Brazil with all that information?
yes.
So when I start to do all seminars,
Right.
even in Goldsted, even in Palmer College, I always think, oh my gosh, I know a lot of my friends from Brazil don't do that because first money
Yeah, sure.
and second, uh most of chiropractor don't speak in English,
Right,
so they can do the same.
right.
And I always think, oh, I really need to bring to Brazil all my knowledge.
Yeah,
I need to transmit all
yeah,
my knowledge and all my patience. And I always think about this. In my opinion, knowledge for you is lost.
Mhm.
You have to
Share it.
share.
Mhm.
Yeah. And so I started work in my pediatric in my pregnancy
yeah.
seminars, and I always think uh about when I start to. I will start with pregnancy because for me, it's more logic. Start with pregnancy and then
Yeah,
kids. So I think about how I can learn pregnancy if in Brazil we don't have a pillow for belly.
right.
So I did in Brazil a pregnancy pillow for
Uh-huh.
my students,
That's awesome.
and all my students receive my notes and a pregnancy pillows.
Awesome.
Perfect.
So
Yeah.
yeah, they can use because I always think about this. With if you buy in USA, is really expensive,
Sure.
Mhm.
and bring to Brazil or came to USA to buy, so it's difficult.
Yeah.
So I did this first, and then I started to do a pediatric series. I always think about this. We don't have nothing for patients for education.
Right.
How kids need chiropractic.
Right.
Why?
Right.
Why? So I'm thinking about I need to do a story,
Mhm.
maybe a little book for education that
Right.
you put in the room.
Right, in the reception area.
Waiting
Or
room.
the-
Yes.
Protection action. Yeah, yeah. So I think about a story. I have a lot of good son and good godson and goddaughters.
Yep, I
Yes.
noticed, yep.
So one of my goddaughters have a father in Cirque du Soleil,
Yeah. Oh, yeah.
and she loves circles. So I think I put
There's your
she
birth. Yeah.
in a story,
Yeah.
Yeah.
and then it's me.
There
Yeah.
you
It's
go.
just about a story. It's about
Yes.
how,
Perfect.
yeah,
Yes.
they did that, and I did in English too
Wow.
Oh, okay.
because I did ICPA gathering maybe 2 years ago,
Mhm.
and I talked to Justin about my book, and he said, "Oh, bring your book and
Right.
you uh
You get a table or booth.
to buy." Yeah,
Yeah.
yeah. So I did this,
Perfect.
and then I'm thinking, oh, I need more. I always think about how do kids treatment is light, funny, how do this? So when I went to a Palmer College, I buy the Fox with a click spine, yeah,
Yeah.
Oh, yeah.
and
Yeah.
I did. Oh, I would talk about my students. I used to talk, oh, I use my Fox and blah, 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 and play with kids, but you don't have this because you have to go to USA to buy, so expensive, blah, blah, blah. I said, no, 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 I need to do this.
Yeah.
So I did the pig
Oh, you
because
get
I love
paid.
pigs with a popcorn and lily pigs, and they click it
I love it.
Uh-huh.
That's amazing.
too. Yeah, and
Yeah.
innate
Innate.
institute.
Yes.
So I create my institute to teach, yeah. And then I think, I need more. And I always think, oh, I talk to my student about, my patients go to the table and then I have a top of table with giraffe. It's so funny. I was more white, yeah. And I think, I have to do this. And then I create my top of tables
Yeah, that's
There you go.
amazing.
Those are awesome.
with popcorns,
Yeah.
and
Yes.
all my students can take just I just sold this my material
Huh?
to my students. So if the chiropractor don't did my seminars,
They can't buy
I
it.
never no they can
Huh?
So
because it's my rule.
So I'm
I-
hoping let me test safe 1 minute so I can stop for a minute and kind of let it kind of take in all that you're saying. I mean, you are a doctor that graduated school in Brazil where there was not the techniques you needed to do, that you sought that out, you made the commitment, you brought it back to the country that you truly love, which is Brazil. Your love of Brazil is contagious, and you have served not only your patients but the profession in Brazil. Like you are laying the foundation for them to have the educational material, the techniques that they need so that they can be successful. Because it's really true. Being the best at something is not satisfying if you can't bring other people along with you. So, you just slightly mentioned your institute, which is just amazing. So you have this school where you are teaching and you are certifying doctors in Brazil. You are the first pediatric chiropractor that certainly has the CACCP or has those credentials with us as well. So we really want to take a moment in just a short period of time. All that you've accomplished is extraordinary. So I want you I want the people who are listening to this to understand not only is this be difficult for someone who is in the United States to have gone through all this, but to travel from Brazil with the different currency and the different language. It's truly remarkable.
What I really like is when you want more,
Yeah.
you go and get it and create it. And
Right.
that's very unique. So sometimes people want more and expect other people to give it to them. When you want more, you find a way to take it and make it. And I know you're going to do this. You're going to give us a tour of your clinic video so that we can show people what you've actually created in Brazil. That it's one of the most amazing clinics I've ever seen. And I've seen thousands of clinics.
Yeah. So
That's
we're taking this moment to celebrate you, not only for the person that you are, but for all that you do for your country and for chiropractic and for the children of your country. So you are such a gift. So I want to thank you for sharing all that so humbly. But you just listen for a moment to see all the things that you have done. It's just remarkable. So I guess what I'd like to ask you is to tell us. Okay, what do you want to say?
I just want to say, I want to ask you to kind of to end it up in talking about you and ask about.
I wanted to just say how you keep motivated.
Right.
Like
What is it
what is it that just keeps?
What is the drive that
Yeah.
keeps you going? Like, yeah, you say you want more, and a lot of people say they want more, and that often comes from a place of greed. That's not where you come from. So we'd really like you to share with people what's that thing that's bigger than you that drives you? You know what I'm asking?
What motivates you?
Yeah. I think when I felt in my body, chiropractic changed my life, and I really need to do for most people I can. So the only thing way I can do this, living in a small city,
Yeah.
is teaching.
Yeah.
So I really need to share, and share
Yep.
because I really need the more and more people know about chiropractic,
Sure.
especially in Brazil, because we are so young here.
Yep.
So I think that's my motivation every day. I always wake up and think, today I will change lives. So when I receive, sometimes I'm really tired
Uh-huh.
because I'm working 10 or 11 hours a day,
Uh-huh.
and every day, all day, I text my students with questions. So I always think, oh, I'm tired. I need to stop. Every day when I think this, I need to stop. I need to keep coming. One student or one patient send me a feedback, amazing feedback, and I think, okay, God, I understand. I still here. So I always think about this. I always pray to God every day. Guide me, guide my mind, guide my hands to do my best to change lives, to promote better feelings and joy for people. So it's funny because all my patients said, "Oh, it's 8 or 9 p.m. You're still like, it's like a body. You're never tired." No, I'm tired inside of me, but for my patients, no.
Yeah.
I'm here because I love what I do.
Mhm.
So I don't see the time is
Right.
fast. So when I say, oh, it's night now, I can go to bed.
Well,
So
this is what we say when you're in a room, whether you're teaching or a student, that you are a light, that you bring a light, that light comes through you. Your joy comes through you, your service, it comes through you. I know that you're speaking in English, but I'd like you, if you wouldn't mind, just taking a moment to speak to your fellow Brazilians a little bit about, about what you want them to get from this, like, as terms of your love of chiropractic. And we can just kind of end on that one if that's okay. Is there something you'd want to share with them in your native language?
uh yes, but I think it's not easy for put
Okay.
subtitles. I
Yeah,
think it's better
We can.
or not.
we'll work it
Yeah,
out.
I think it's better. Yeah. So that's it.
Very good. Anything else?
Yeah.
What is it?
No, it was awesome as always to be in your presence and
Yes,
talk here.
yes, it is such a
Just
great.
But
1 minute. I
Yeah.
forgot that. I just want to say for everybody who watching this video, never, never, never stop studying with this couple because they are amazing. You guys really, really, really changed my life. I always use always your classes, all your or learns because it's really different. It's I saw about this with all my students, all my patients. Everybody knows you because I always say this couple is the best of the world, and I bring these guys to my city.
no,
I can't live there. And I
It was
really,
wonderful.
really thank you so much for came to Brazil, for do the seminars in Portuguese now, to do this happening because you really, really change lives. Your life is a gift for me and for world. So thank you so much.
but
And students, never get up.
We're not
If
going to
I
cry.
do this, you can do this.
thank
Yeah,
you,
that's it.
Lillian.
Thank you, Lillian. So you're so amazing.
You are. It
I'm
was
so
great
glad.
talking to you today.
You want to? Oh, we
You
want to
want-
record? Stop recording.
Oh, go ahead. You can talk.
Okay. No, I really want you to, you speak very well. And so
Mhm.
you're very clear. So don't stop sharing because you think your language
Okay.
isn't,
Yeah.
it's not true. You come across very clear.
Besides, it's not only what you say,
Yeah.
it's how you say
You
it
say it.
and how we feel.
So,
That's all.
yeah.
What
Okay.
an awesome talking to you tonight.
Yeah. You can just